This is Educators Respond. This video and audio podcast series is dedicated to supporting educators as they respond to the COVID-19 crisis. The goal is to create conversation around how to effectively support the physical as well as social and emotional well-being of all members of school communities in Pennsylvania and beyond. On May 12th, the Senate Committee on Health, Education, Labor, and Pensions held a hearing with health and medical experts to discuss the state of research and development in response to COVID-19. What follows here is an edited version of that hearing, focusing specifically on parts relevant to education and schooling. I am your host, Kevin Hulburt. I was a high school English teacher in Pennsylvania for a decade, and am now a doctoral candidate at Penn State. And I'm joined in this discussion today by Kevin Briggs, a fellow former English teacher turned doctoral candidate who also served as an assistant principal for 5 years. Kevin, thank you so much for joining me today.
I'm very happy to be here.
So let's go ahead and get started. This first clip is the opening statements. It's from the opening statements by Senator Lamar Alexander, who's the chairman of the committee, and he starts us right off. So the structure of this, we did edit the hearing to remove sections that were not related specifically to education or did not seem relevant to the conversation. And so what we'll do is let the senators and the experts speak for themselves, and then we'll take a moment to kind of respond to what it is that we're hearing. So this first clip again is from the chairman, Senator Lamar Alexander.
At our hearing last Thursday, I said that all roads back to work and back to school run through testing, and that what our country has done so far on testing is impressive, but not nearly enough. According to the Johns Hopkins University study, the United States has tested over 9 million Americans for COVID-19. That's twice as many as any other country. We don't know what China has done. And it's more per capita than most countries, including South Korea, which many members of our committee had cited as an example of a country that had tested well. According to Dr. Deborah Birx, the United States will double testing in the month of May, which should get us up to about 10 million tests conducted. Now, here's what I mean by impressive here in Tennessee, where I am today. First, anyone who's sick, first responder or healthcare worker can get tested. Our governor, Bill Lee, is also testing every prisoner, every resident and staff member in a nursing home. He's offered weekend drive-through testing. He's done specific outreach for testing to low-income communities. A Tennessean can get a free test at the local public health department. The governor's slogan is, if in doubt, get a test. Governor Lee sent his testing goals in May to the federal government, as every state has done. Federal government is helping him make sure that he has enough supplies in case he has trouble getting them through the labs and the other commercial sources. As a result, our state has tested about 4% of the population. The governor hopes to increase that by 7% in May. That's one of the best in the country. This impressive level of testing is sufficient, we believe, to begin phase one of going back to work. But as I said last week, it's not nearly enough to provide confidence to 31,000 students and faculty members, but we hope will show up at the University of Tennessee campus in August when school starts. Last week, I talked with UT Knoxville Chancellor Don D. Plowman about that. We said, what would persuade those 31,000 students, as well as the 50 million K through 12 students in the country and the other 5,000 university students, what will persuade them to go back to campus in August? That's where the new Shark Tank comes in. Dr. Collins at the National Institutes of Health calls it RADx. We had our hearing about that on Thursday. It's a really remarkable scientific exercise to take a few early stage concepts that are swimming around in what we call that competitive Shark Tank, and see if Dr. Collins and his associates can find a few new technologies to create millions of new tests that will scale up rapidly and make it more likely that students will go back to school in August. For example, the FDA authorized last week its first diagnostic test using saliva that a person provides at home instead of a nose swab or blood. It authorized its first antigen test. We're hearing a lot about those, like the ones used for flu or strep throat, which involves the swabbing of a nose, and you can get the result in just a few minutes. Another proposal, not yet approved is to put in your mouth a sort of lollipop sponge. Take a photo of that with your cell phone and send that to your doctor. If it lights up, you're positive. Or the university might send that saliva lollipop to a nearby laboratory, which could be a gene sequencing laboratory, which can deal with thousands of those samples overnight. That same process could occur at a middle school. It could occur at a factory. Of course, anyone testing negative one day can test positive the next, but such widespread screening of entire campuses, schools, or places of work will help identify those who are sick, trace down those who are exposed, and that in turn should help persuade the rest of us to go back to school and back to work. In addition to more testing, I expect Dr. Fauci talk to us about additional treatments that will be available to reduce the risk of death, and the administration's plan to do something that our country has never done before, which is to start manufacturing a vaccine before it actually has been proven to work in order to speed up the result in case it does work. Those vaccines, those treatments are the ultimate solution. But until we have them, all roads back to work and school go through testing. The more tests we conduct, the better we can identify those who are sick and exposed. Then we can quarantine the sick and exposed instead of trying to quarantine the whole country. Now, in my opinion, this will require millions of new tests, many from new technologies. Some of these will fail, but we only need a few successes to get where we want to go. That's why I said on Thursday that what our country had done so far in testing is impressive, but not nearly enough.
Yeah. So, what do you think as opening statements?
It's clear. I mean, they're putting a lot of, he's putting a lot of emphasis on testing and reopening schools.
Yeah. Yeah, no, I agree. And so there's kind of an optimistic view that we will have testing in place. And right from the beginning, he seems to be setting it up rhetorically to say it's likely we're reopening in August, a kind of optimistic forecast that we'll have the tests in place so that universities as well as public schools could reopen in the fall. It seems to me that that's a pretty strong rhetorical stance to take from the beginning. There was not a lot of holding back assessments. It was a pretty strong encouragement that that is the direction we are hoping to achieve, and that's the goal, is to reopen in the fall. And that all roads lead through testing, right? So if the testing is in place, we will be able to effectively open.
Yeah, this theme seems to be right from the beginning. The goal is to reopen. We're going to be able to do that through testing, or that's where our focus is going to be anyway.
Yeah. So the response, the kind of Democratic response, is from Senator Murray, Senator Patty Murray from Washington. And so this was her opening statement.
Testing alone won't be enough to reopen our country. We still need far more personal protective equipment than has been available for our healthcare workers on the front lines. And we will need far more for other workers as we reopen. So we desperately need this administration to step up and get that equipment to states who are doing everything in their power to purchase supplies, but simply cannot get nearly enough. Because the reality is, unlike states, the federal government has the tools to actually fix the problem, if only the administration would use them. And we also need that equipment to actually work, and for the FDA to act promptly if it does not weeks later when people may have already been exposed. And just as importantly, we can't expect people to go back to work or to restaurants or to confidently send their kids to school if there isn't clear, detailed guidance about how to do that safely. Schools, from early childhood through college, need to know how to keep their students, their staff, and their educators safe. When should they wear masks? How do you run a school cafeteria or a school bus? And if they can't reopen classrooms, schools and families need to know we are working to ensure every student gets an education. Tools like online learning can only get us so far if we don't address the digital divide so that every student can access them. And even then, there will be learning loss that could deepen existing educational disparities among low-income students, students with disabilities, English language learners, and other vulnerable populations if we don't make sure they get equal access to resources and support.
So as a response here, Senator Murray really says, okay, yes, testing, but not only testing, right? In addition to testing, we need detailed guidelines so that schools have a protocol in place for what reopening looks like, what running a cafeteria looks like. And then in addition to that, we need PPE, we need masks, we need supplies in place at those facilities so that they can open safely. And so, now it's testing plus guidance plus supplies, which I think makes a lot of sense. That obviously all those need to be in place, and kind of emphasizing a need from the federal government to get involved to make sure that those supplies and that guidance is fully developed and available to schools with enough time to consider implementation and to actually, set up the physical facilities.
Right. I see this statement leaning a little bit more closely, I should say, or maybe more specifically to a top-down response. It's a little bit of okay, federal government, you have the resources to quote unquote solve this and or make a more robust response. That kind of message. Interesting to me, she brought up online learning. And not that, this is everything is so new. It's all kind of daily new, and maybe even multiple points during the day, things are new. But online learning is obviously stepped right into the forefront of the whole K-12 educational process in America. And so it'll be really interesting to see what the developments are with online learning as we move forward with all of this.
For sure. Both in the current realities of schools across the country being online or having some sort of hybrid model. Going forward into the fall, this is one of the only times during the entire hearing where someone raises the possibility that we're still online in the fall, or that there's a hybrid model. The majority of the rhetoric talks about reopening and what was needed for reopening, but she does raise that idea of the potential that we might remain online or have some sort of hybrid system in the fall. And if we do, then as a country, we have to take seriously the digital divide across the nation. That access and equitable access are critical issues and very complex issues. It's not only do families have internet at home, it's also how many devices do they have in the home, and how reliable is the internet, how fast is the internet, are they able to watch videos that are recorded by teachers, or do we need to provide kind of slower internet speed resources so that students who are on dial-up, which is still exists in the country, are able to access that and able to get those resources or download them overnight and then use them the next day. So I really appreciated her bringing those questions up because at the very least, this current crisis has brought that to the forefront of attention, that's a critical issue when it comes to education, and always has been. So that was I would agree. And again, we're not going to hear a lot of that in the hearing throughout.
It's huge. And if I could say one more thing, pardon me, it's the tension of it all is of the online learning piece. As any teacher and educator and now parents and students in America, and we'll say, there's a question of quality of education. These are the questions that surround it, and the answers will, our responses and answers will be rolling out as time goes on. But questions around quality of online learning, if people even have access to it. And so, there are already questions surrounding how much we believe in online learning to begin with, because of the high premium on face-to-face interactions between teachers and students. And so that question remains, even though there's a sense of urgency to keep the educational process going and to keep our teachers working. So now we're saying, okay, no, yeah, we can do all the online learning. And now, though, but not everybody has it. And so we're balancing this thing that we think we believed in all this time. That's now the main mode of education. Plus, does everybody have it? And so those are then the efforts kind of involved in, or maybe I guess the points of focus in that discussion.
Yeah, which still has yet to really unfold in I think, a serious way. I mean, not that there aren't people asking those questions, there are, but what are our best guesses? What are the protocols that we think are most effective in an online environment? We're somewhat doing what we need to do this year, but in the fall, we have this preparation time to kind of consider those big questions. So then we return to Senator Alexander, who speaks directly to Dr. Fauci, as well as Admiral Giroir, who's the Assistant Secretary for Health, and Dr. Redfield, who's the Director of the Centers for Disease Control and Prevention. And so we'll hear that exchange.
Let's look down the road 3 months. There will be about 5,000 campuses across the country trying to welcome 20 million college students, 100,000 public schools welcoming 50 million students. What would you say to the Chancellor of the University of Tennessee, Knoxville, or the president or the principal of a public school about how to persuade parents and students to return to school in August? Let's start with treatments and vaccines first, Dr. Fauci. And if you could save about half of my 5 minutes for Admiral Giroir for testing, I would appreciate it.
Thank you very much, Mr. Chairman. Well, I would be very realistic with the Chancellor and tell him that when we're thinking in terms...
It's a her in this case.
Oh, okay. I would tell her, I'm sorry, sir, that in this case, that the idea of having treatments available or a vaccine to facilitate the reentry of students into the fall term would be something that would be a bit of a bridge too far. As I mentioned, the drug that has shown some degree of efficacy was modest, and it was in hospitalized patients, not yet or maybe ever to be used either yet as prophylaxis or treatment. So if the issue is that the young individuals who will be going back to school would like to have some comfort in that there's a treatment, probably the thing that would be closest to utilization then would likely be passive transfer of convalescent serum. But we're really not talking about necessarily treating a student who gets ill, but how the student will feel safe in going back to school. If this were a situation where we had a vaccine, that would really be the end of that issue in a positive way. But as I mentioned in my opening remarks, even at the top speed we're going, we don't see a vaccine playing in the ability of individuals to get back to school this term. What they really want is to know if they are safe. And that's the question that'll have to be due with what we discussed earlier about testing. So I'm about halfway through the remarks. I'd like to just pass the baton to Admiral Giroir, who would address the question of the availability of testing and what role that might play in returning to school. Thank you, sir.
Well, thank you, Doctor. Thank you, Dr. Fauci. And Admiral Giroir, you said that while we're doing about 10 million tests this month, that we might be as high as 40 or 50 million by September, and a month, which is a significant increase. So if I'm Chancellor of the University of Tennessee, could I develop a strategy where I'd say to all my students, we have, for example, an antigen test, which is quick and easy. You want everybody on campus to come by and take it once before you begin school. That will at least let everybody know that on that day we've isolated anybody who's positive, and then we can continue to monitor. Is that strategy possible in August and September?
So thank you, Mr. Chairman, and I may reserve 20 seconds for Dr. Redfield as well. The strategy that's going to be employed really depends heavily on what's the community spread at that time. If there's almost no community spread, your strategy will be different. If there's high community spread, it will also be different. But yes, technically, we will have the ability, and your chancellor will have the ability. We expect there to be 25 to 30 million point of care tests per month available. It is certainly possible to test all of the students, or it is much more likely that there would be a surveillance strategy done where you may test some of the students at different times to give an assurance that there's no circulation. And that would be done in conjunction with the CDC and the local health department. There's also strategies that are still needing to be validated, but of pooling samples. We know in some experimental labs as many as 10 or 20 samples can be pooled. So essentially one test could test 20 students. And finally, there are some experimental approaches that look interesting, if not promising, that, for example, wastewater from an entire dorm or an entire segment of a campus could be tested to determine whether there's coronavirus in that sewerage, the wastewater. So there are other strategies being developed. And I'd like to at least give 20 seconds to Dr. Redfield, who really will be working on the strategy of how to employ the test given different community spreads.
Dr. Redfield?
Yeah, just some quick comments, sir. I mean, first, I think it's really important to evaluate critically the role of changes in social distancing on college campuses and schools and the situation, not to forget the importance of what we've learned. Clearly, also developing an aggressive program for wellness education, making sure people understand when they're symptomatic, they need to seek evaluation. I think you are going to have to look at the role of testing. I think there is going to be an important role of testing in this circumstances, and I think it will be individualized based on where these different schools are, how much infection is in that.
Here, the Chairman Alexander sets up a hypothetical situation of speaking to the Chancellor of the University of Tennessee, Knoxville, and what would you say to her in order to create a sense of that it's appropriate to reopen? And we hear from Fauci, we hear from Dr. Fauci, we hear from Admiral Giroir, and then we hear from Dr. Redfield on the topic. And they start with the idea of cures and vaccinations. And Dr. Fauci is pretty quick to say that that's not likely to be the situation here, that in August and September, it's not likely that we're going to have a cure or vaccinations as a response to, yes, it's safe to go back to schools. And so again, it comes back to testing. And so is the correct amount of testing in place for to be appropriate to reopen? But in addition to that, there's another question that is raised here for the first time, which is the perception of safety in addition to actual safety levels. And how do we get the perception of safety to be in place where students feel comfortable returning and parents feel comfortable sending their younger children back to school?
There's a lot in there. Then we get a statement by the admiral about having a strategy, and depending on what's going on in the local community, which will depend on what happens, but confirming that there is availability of tens of millions of tests per month. And then also brings up this concept of wastewater testing, which is something that, unlike the lollipops, it is something that actually has some evidence behind it. And really, you can go back to about mid-April, and the first maybe breakthrough along these lines was that officials from France announced that they were able to detect COVID-19 in wastewater. And in fact, they were able to do so over a little bit of a span of time where they saw the levels ebb and flow, kind of rise and fall. And then there were instantly implications for that to be able, for prevention of COVID-19. Like if we can keep keep an eye on what's going on in the wastewater, then we can see where outbreaks are swelling or where an area is not so maybe at risk right at the moment. And the thing about that kind of approach is it's also instant. So you can instantly look at the water and know what's in there. And so this is something that has a lot of optimism. Now, for a while, France was the only country doing it, or maybe willing to talk about it or something. But then what happened, just even a couple days ago, Israel announced it's doing the same thing. And so now there are at least two nations in the world that are officially saying on mainstream media outlets. It was Yahoo News that, I'm sorry, it was a US News and World Report that reported the Israel water testing. So there is something there, and it's I don't know the logistics of it, but it's leaning again towards this idea of testing and Dr. Fauci's idea of everybody feeling safe to go back. And then really with the Dr. Redfield, with the final commentary just had to do with social distancing, promoting wellness, and testing. So kind of a really three-pronged approach. So it seems that these three speakers, there was a nice run there of, okay, here's what we can do, and they're kind of on the same, sticking to the same thread, so to speak.
Yeah, for sure. And to be fair to these professionals, they're covering a lot of ground and they're trying to do so concisely, and there's not a lot of room to expand on every issue. That said, you brought up Dr. Redfield's comment, and he said clearly also developing an aggressive program for wellness education, making sure people understand when they're symptomatic, they need to seek evaluation. And so here he points towards the need for an educational response to teach students and probably teachers and staff as well how to protect themselves. And he references the word wellness there, but I do feel like this kind of underplays the educational challenge that will represent. So we've got a lot of different narratives out there about what this crisis is and how to respond to this crisis. And we're going to have to, our schools are going to have to come together and develop one narrative of this is how we are responding. This is the protocol in the school. This is why we're doing it. This is how we take care of one another. And when we think about that across the educational spectrum from K to 16, that's a huge educational undertaking. That's curricular development. And we know from prevention science that that's really challenging work to change behavior, to change beliefs, especially if they're coming from family units that may have a different narrative of what this situation is. And so I do think that it's good that it was raised, at least, and this idea that physical safety or statistical safety is not the same thing as feeling safe, and that we have to address both those. I was really glad that was brought up and recognized, at this stage. But I think we're going to have a lot more conversation around that, of what that really will look like.
Yeah, Kevin, if I could add, it's just a really interesting conversation, because what we have here is a federal hearing that's going on, and from start to finish so far, the bottom line is really, we can test this to see if it exists. I mean, that's really what the bottom line is. And so it seems that each speaker, that's at least a major component of what they're saying, is talking about the testing. But it's really interesting that the way this is rolling out, and any educator out there in America will likely be able to say that the federal government's role in public education has increased, I'd say, particularly in the past 2 or 3 decades, certainly since No Child Left Behind and that kind of thing all came out. But historically, the federal government is not so much involved in local school districts and education, and it's really a responsibility that is handed over to the states to then work with their local communities and school boards, and that's what the whole premise is local control. So it'll be really interesting to see how it plays out. We already see a few talking points in there about, this is what schools and school communities should be doing with testing, and but the federal government should have a little bit of a more robust role here, because we need everybody to be doing this thing. And it's another tension that exists right now. How much of a role does the federal government have in local education efforts? And in this particular situation, which is a public health concern, how much does the federal government, how much is their role, and how much should it be in this kind of situation?
Well, and to add to that, our shelter-in-place protocols were largely at the state level. So Pennsylvania made a decision to close all schools. Pennsylvania makes a decision to shelter in place, and Admiral Jerwa here really introduces the idea that this is going to have to be a local solution, that individual school districts are going to have to be tested, and individual school districts will open or close based on the risk factors of that community, which I think makes a lot of sense, but it's a very complex system. And to your point about federal, state, and local levels, that's a lot of organization that has to take place for a local district to say, okay, this is the risk level, we need to close, or we are safe to open, and the state approving that, right? And at the federal level approving that, or at least, what are the guidelines for a local district to make those determinations? And that we've yet to see those kind of guidelines come out, and that kind of makes sense, right? That as that rolls out into the future. So in this next exchange is between Senator Rand Paul and Dr. Fauci.
Regard to going back to school, one thing that was left out of that discussion is mortality. I mean, shouldn't we at least be discussing what the mortality of children is? This is for Dr. Fauci as well. You know, the mortality between 0 and 18 in the New York data approaches 0. It's not going to be absolutely 0, but it almost approaches 0. Between 18 and 45, the mortality in New York was 10 out of 100,000. So really, we do need to be thinking about that. We need to observe with an open mind what went on in Sweden, where the kids kept going to school. The mortality per capita in Sweden is actually less than France, less than Italy, less than Spain, less than Belgium, less than the Netherlands, about the same as Switzerland. But basically, I don't think there's anybody arguing that what happened in Sweden is an unacceptable result. I think people are intrigued by it, and we should be. I don't think any of us are certain when we do all these modelings. There have been more people wrong with modeling than right. We're opening up a lot of economies around the U.S., and I hope that people who are predicting doom and gloom and saying, oh, we can't do this, there's going to be a surge, will admit that they were wrong if there isn't a surge, because I think that's what's going to happen. In rural states, we never really reached any sort of pandemic levels in Kentucky and other states. We have less deaths in Kentucky than we have in an average flu season. It's not to say this isn't deadly, but really outside of New England, we've had a relatively benign course for this virus nationwide. And I think the one size fits all that we're gonna have a national strategy and nobody's gonna go to school is kind of ridiculous. We really ought to be doing it school district by school district, and the power needs to be dispersed because people make wrong predictions. And really the history of this, when we look back, will be of wrong prediction after wrong prediction after wrong prediction, starting with Ferguson in England. So I think we ought to have a little bit of humility in our belief that we know what's best for the economy. And as much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. We can listen to your advice, but there are people on the other side saying there's not going to be a surge and that we can safely open the economy, and the facts will bear this out. But if we keep kids out of school for another year, what's going to happen is the poor and underprivileged kids who don't have a parent that's able to teach them at home are not going to learn for a full year. And I think we ought to look at the Swedish model, and we ought to look at letting our kids get back to school. I think it's a huge mistake if we don't open the schools in the fall. Thank you.
Mr. Chairman, can I respond to that even though there are only 32 seconds left?
Yes, and you might make it clear whether or not you suggested that we shouldn't go back to school in the fall.
Well, first of all, Senator Paul, thank you for your comments. I have never made myself out to be the end-all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence. There are a number of other people who come into that and give advice that are more related to the things that you spoke about the need to get the country back open again and economically. I don't give advice about economic things. I don't give advice about anything other than public health. So I wanted to respond to that. The second thing is that you use the word we should be humble about what we don't know. And I think that falls under the fact that we don't know everything about this virus. And we really better be very careful, particularly when it comes to children, because the more and more we learn, we're seeing things about what this virus can do that we didn't see from the studies in China or in Europe. For example, right now, children presenting with COVID-19 who actually have a very strange inflammatory syndrome, very similar to Kawasaki's syndrome. I think we better be careful if we are not cavalier in thinking that children are completely immune to the deleterious effects. So again, you're right in the numbers that children in general do much, much better than adults and the elderly, and particularly those with underlying conditions. But I am very careful and hopefully humble in knowing that I don't know everything about this disease, and that's why I'm very reserved in making broad predictions. Thank you.
All right, I'm just going to say it right up front. I'm a fan of Fauci. I'm a big fan of Dr. Fauci. I think that he is humble, and I think that he responds eloquently to charges to the opposite there, which is great. I do think Senator Paul raises very valuable statistics in terms of what we're seeing so far in impacting children, and more recently we do see this issue of the Kawasaki disease similarities, and that's frightening. I mean, and that's important for us to continue to investigate. That said, the numbers there are extremely low. So in the New York City Health Department report, there were 15 cases of children ages 2 to 15 that were hospitalized for symptoms similar to the Kawasaki disease. And that's, of course, horrible. 15 young people were impacted in this way with high fevers, with rashes, and more severe symptoms. But it also is a very small number. And so I think that Senator Paul's point is that this is the COVID-19 pandemic largely impacts older Americans. And I think it's a great point and an important point as we consider reopening schools. That said, one aspect that's not raised here, and in fact, throughout the entire hearing, the word teacher is never said by anyone. And a majority of teachers are in that older demographic. So it is important to recognize that this doesn't largely, the effect on children is less, but the effect on adults, including the professionals who will be working in educational settings, is significant and important to take into account as well.
But like you said, neither Senator Paul nor Dr. Fauci are talking about teachers or the professionals that you say, many of whom are over 50, and many of whom have their own levels of vulnerability in terms of health and well-being. So, you know, I think it's, I don't want to get into any analysis here, certainly, but I think some things to pay attention to for our listeners, and what we should all be listening for in some way is knowing a little bit about who the speaker is. There are certainly politics that are in all of this thing, but you know, you generally have a group of people who are pushing for reopening a little more strongly and are pushing for things like testing, and we're talking kids, and it's not too bad. And then we have a group of scientists essentially who are trying to stick to the facts, and all of us researchers certainly appreciate that. Dr. Fauci's a model scientist in a lot of ways, in that he just will not step out of his lane. He's like, this is what my contribution is. I'm a scientist. Here's what we know, but I'm cautious in this way, you know, that kind of thing. And they're all talking about kids all the time. And so historically, talking about kids is politically, it's a political sanctuary to talk about kids. I mean, nobody can argue with talking about what's good for kids. But the truth of the matter is that kids are not the only people that go to our 100,000 schools every day. The workforce of teachers is huge. Even in Pennsylvania alone, I mean, if you think about the scale of our education system, it's really pretty impressive. Just in Pennsylvania alone, we have 500 or 501, I'm not sure what the tally is today, school districts. And so these are vast numbers of people with a vast workforce that goes in there. And every teacher that's going into that situation also could potentially have a family of school-age people too, of people who are over the age of 50. And so I think essentially I disagree that there's hasn't been much of a focus on teachers at this point.
Yeah. So this next clip is from Senator Bill Cassidy, who speaks with Dr. Hahn, who's the Commissioner of Food and Drugs, as well as with Dr. Fauci and Dr. Redfield as well.
But Dr. Redfield, to build back upon what Senator Murphy said, the published guidelines for school opening obviously are about to modify, but I notice as I read through them, there's nothing about testing. So we speak about testing, targeted testing, how we use testing, but the guidelines for the school systems has nothing about how to integrate testing. Will these be in those guidelines that are being released?
Senator, thanks for the question. Clearly, there's going to need to be, as already been stated, an integration of a testing strategy that is going to be different, I think, for different school settings, as well as different jurisdictions where their schools are setting. And that is going to have to be integrated into each of those. There's a general overarching guidelines. And then, as I say, I do think the testing strategy, which is important, is including the surveillance strategy, needs to be a individualized.
No, let me comment on that, Dr. Redfield. Dr. Redfield, in all due respect, I think children, whether you're rural, frontier, suburban or urban, is the one setting in which there is a remarkable commonality. And I will echo what Senator Murphy said. The resources that the federal government has greatly exceeds all but the most sophisticated, populous, wealthy state. And even then, it exceeds it by some extent. So I do think it would be good to have, okay, in a primary school setting, this is best practices, or these are three options, and choose between one of these three. To say to each school district or each private or parochial or independent school, work with your state board of health, figure it out, seems a wasted effort. I say that because children play such a role in both protection of disease, the spread of disease, et cetera. So your thoughts on that? Because it really seems that's the one setting where you can have, you know, not cookie cutter, but certainly a pattern which can be followed.
Senator, I must have been misunderstood. When I was talking about differences, I was thinking of the difference between an elementary school, a high school, a college, in terms of how a trade school. There may be differences in how you integrate a testing strategy, but I do think having a testing strategy with different options for people to evaluate based on different principles will be important in terms of guidance.
Dr. Fauci, you persuasively argue that the risk of reopening prematurely is great. But I think the frustration, if I think of children in particular, the risk-benefit ratio of a child being at home, potentially away from enhanced nutrition, without the parent able to work because school provides daycare, without the monitoring as sometimes occurs for incidences such as child abuse, but perhaps most importantly for all children, the opportunity cost of a brain which is forming, not having access to the information that will help that brain form optimally. Now, has there been any sort of kind of risk-benefit ratio for the child? Yes, they are at risk for Kawasaki's, but they are a particular risk for missing out on a year of education, particularly for those from less enriched backgrounds. I guess I'm very concerned about that tension. What are your thoughts on that?
No, you make a very good point, Senator Cassidy. That's obviously very difficult of the unintended consequences of trying to do something that broadly is important for the public health and the risk of having a return or a resurgence of an outbreak, and the unintended deleterious consequences of having children out of school. We fully appreciate that. I don't have an easy answer to that. I just don't. We just have to see on a step-by-step basis as we get into the period of time with the fall about reopening the schools, exactly where we will be in the dynamics of the outbreak. I might point out something that I think has been alluded to throughout some of the questions, that we have a very large country and the dynamics of the outbreak are different in different regions of the country. So I would imagine that situations regarding school will be very different in one region versus another, so that it's not going to be universally or homogeneous. But I don't have a good explanation or solution to the problem of what happens when you close schools and it triggers a cascade of events that could have some harmful circumstances.
Mr. Chairman, I'll close by asking the permission of the chair to submit for the record an article that just came out in the Journal of Pediatric Nursing. Children are at risk from COVID-19.
So here we really highlight two of the critical tensions that we're facing in education. One is regionality, and this idea of the differences between different types of schools, as well as the differences between different communities and different regions of the country and what they're facing with their specific challenge. And there's a call for the kind of leadership guidelines for how schools should implement testing. And is there a way that we can, I think Senator Cassidy uses the term cookie cutter. Is there a system that we can say, this is what you should do, or this is best practices for every school? And then on the other side of that might look different in different types of communities because of regional differences and rates of risk, as well as population, even access to resources. Could affect how they implement testing. So that's one tension, right? This idea of regionality, but then also wanting guidance of what is best practices and what should all schools do versus what should our school do. And the second tension that really this highlights is the cost-benefit analysis. The article that he points to at the end and he enters into the record that children are at risk is a description of the kinds of risks they face if we do not return to school. Things like job loss and the impact that has on children, and not having access to school resources. For example, we know that in Maryland specifically, Child Protection Services reported that there's nearly 70% fewer calls for child abuse, which we would like to think is because there is less occurrence of child abuse, but is also likely a result of children not being in front of mandated reporters who bring to light abuse cases. So we do know that is a cost-benefit analysis, that this does have an impact on families and children, regardless of whether or not they are symptomatic, carriers of COVID-19. So that he raises that tension, which I think is kind of carried throughout the whole hearing. And how do we measure that? And really, there's no easy answer to that question.
Those same kids who go to school and get meals are also going to school for safety, and also going to school to meet with whatever counselors and therapists and support personnel, nonetheless the teachers. And so the school, it brings up a lot. There's a safety concern about getting a large proportion of the school-age kids in America out of their homes during the day, where the place where it's warm and they can eat, and there's not a source of abuse necessarily going on in the school like there would be at home. Well, now all those kids are in those places all the time. All the places where children and youth services are going to visit and try to have an intervention and try to work with families within the community and do all these things. Those people are all together all the time right now. So that there's a high sense of urgency.
Yeah, I mean, let's acknowledge an elephant in the room, which is, for political reasons, is not necessarily represented fully here. You can't open an economy if you don't open schools. Parents can't go to work if their children aren't going to school, or at least that adds a significant burden on the process. And it sounds heartless to talk about that as a politician, so I think it's underrepresented in the conversation here. But underlying this entire hearing is this idea that we want to reopen the economy, but to reopen the economy, we have to reopen schools, which means we're sending kids there. So the cost-benefit analysis is an economic one, in addition to a wellness one. And no, please.
I'm saying it's really interesting. This puts right in the forefront of the conversation also, and really for some other time, but the topic would be, what is the role of schools in America? And there's definitely, we have a pretty clear academic mission with schools. But then what are our schools for? I mean, they clearly serve a purpose that's in addition to academic services. So when we start getting into, okay, kids go here to school, schools are still offering meals for students who would typically get them. And so, okay, kids are going to school to eat, they're going to school to be safe and warm and satisfy some basic survival needs.
And to develop socially, and to develop those social skills and have relationships and interact with peer groups. Yeah, for sure, right? In addition to those academic outcomes. And if anything, this crisis has raised to awareness all those roles that schools play.
Right. And everything our professionals in the schools are doing. I mean, the teachers, we were both teachers. I had 10 years as a teacher, 5 as a building level school administrator. And what I can say about every position within the schools, people are wearing multiple hats, and the position that they're hired to do is one aspect of what they're doing. The truth is, as you and I know through our research, teachers are making thousands of decisions a day, and they're in this very complex environment all day long, as are paraprofessionals, as are school administrators. Anybody who's walking into that school, into our school buildings, even if it's a small building or if it's some humongous, thousands of students in the building kind of place, are walking into a really complex system where there's just a heck of a lot going on, and the roles of schools have expanded even in our lifetimes, considering what it was like when I was in a K-12 setting through the 1980s and the 1990s, and even into higher ed. I mean, when I went to college, there still wasn't even email that people were using. So things are so different, but the role of the school has expanded so much that it serves this academic purpose, it serves a social emotional purpose in a significant way. And now what we're seeing is the importance of school systems on our economy, which is not something that has been discussed a whole lot. We've maybe taken it even for granted that our children go to these places with all these professionals and all these adults doing all these things, and then we can go and have our 1 or 2 jobs and support our families. When that's taken away, one of the things that comes up into the forefront is this economic impact. So you definitely hear that in what the people are speaking about.
In a time of so much uncertainty, I've stopped talking about things in terms of setting goals, because there's just so much uncertainty so what is a realistic goal? It becomes difficult to judge. But I do think we can talk about intentions. And going forward, that we in education can set an intention to better communicate to communities and what it is that happens in schools, and the need to support our public education system, because it's the bedrock of our entire economy. It's the bedrock of our future. It is a critical system that not only educates our children, but protects our children and helps them to develop into healthy human beings, both physically and socially and emotionally. And that's a really strong intention of this podcast series, is to really highlight what we're seeing now is what's always been there in a lot of ways. And we need to kind of support schools going forward. So I just want to end today with Senator Alexander's closing remarks and conversations with Dr. Fauci and Admiral Giroir.
I want to make sure I didn't create some confusion by the way I asked the question about going back to school. I asked Dr. Fauci first about treatments and vaccines, and Dr. Admiral Giroir second about testing. What I thought I heard was that Dr. Fauci said that vaccines are coming as fast as they ever have, but it'll be later in the year at the earliest before we see that there's some treatments that are modest but are promising. There could be more, but that doesn't mean you shouldn't go back to school. That would be more for a testing strategy. Am I right, Dr. Fauci? You didn't say you shouldn't go back to school because we won't have vaccines by the fall.
No, absolutely not, Mr. Chairman. What I was referring to is that going back to school would be more in the realm of knowing the landscape of infection with regard to testing. And as Admiral Giroir said, it would depend on the dynamics of the outbreak in the region where the school is. But I did not mean to imply at all any relationship between the availability of a vaccine and treatment and our ability to go back to school. You're quite correct.
And what I heard from Admiral Giroir was that you're ramping up current technologies. You are hopeful for Dr. Collins' Shark Tank and the National Institutes of Health, but in any event, you would expect to have the capacity in the fall of 40 to 50 million tests a month, and that ought to be adequate for the principal of a middle school or even the chancellor of a campus to design a testing strategy that could provide, for example, an antigen quick test to screen all the students in the school if necessary. Is that correct?
Yes, sir, Mr. Chairman. And again, we want to make as many tests available as absolutely possible. What I said is what I feel comfortable with, knowing the production schedules, being in the position of being able to work with the FDA and CDC, that we should have 40 to 50. We will have 40 to 50 million tests available per month that need to be deployed in a smart, strategic way, depending on the dynamics, in that area and in that region. Still having testing even widely, does not nullify the need that we're going to have to change our practices in terms of sanitation, personal cleanliness, distancing, face masks, things like that, given what the dynamics could be.
But well, thank you for those comments, because given that number of tests that will be available in, say, 3 months, or as we ramp up to that number 3 months from now, that should give every principal, every chancellor of every college campus, and again, we have about 5,000 campuses and 100,000 schools, some reassurance that testing, as well as the common sense hygiene practices you talked about, could be used to develop a strategy for reopening school in August.
My final takeaways with the hearing that occurred this week are that there's general consensus that there will be enough tests to create confidence that we can test in school communities in order to open in the fall. There is a rhetorical push to move in the direction of opening in the fall. There is the tension between regionality and what is the role of local communities to make decisions versus state level versus federal level, and that ties to political history, but that is going to be an ongoing concern. So there's a general call for guidance, at least from the national level, and a need for supplies. I do think that there's underrepresentation of the unbelievable educational effort that's going to be needed this summer to consider what happens at a curricular level, what happens at a school community level in order to reopen the doors. I don't feel as though that was talked about enough, and perhaps it's because of the nature of this hearing and who they were speaking with and what their expertise is, to be fair. But that we're going to need to do a lot more to take that seriously and to really consider the educational needs of faculty and students for their physical well-being as well as their social and emotional well-being as we return to a school. So I'm looking forward in this podcast series to kind of exploring those questions this summer and to providing educators with access to experts, access to research, and access to each other to collaborate and discuss as educators respond across the country. And they will be responding. They have been responding in amazing ways and will continue to do so. So I think that there's a lot here. So I don't know, what are your final takeaways, Kevin?
Well, I mean, quite a bit, because everything, I'm on board with everything that you're saying. Not only do we need to make sure we have a response. I mean, there are millions of people tied up in whatever the response is. It's like we need to have one, and we're going to have one because we kind of have to have one. We have this institution in our country of, and certainly state levels of public education, and that kids go off in the morning to this place and they get kind of taken care of and learn things, and they come back. And this is, as we've talked about, an integral component of now what we're seeing, the economy, which is something that, again, it just hasn't been discussed before, because I think
no, schools have not been valued in that way.
We've taken it for granted. And
for sure.
And here's the thing that I would like, that is a takeaway to me, because what happens with this and all this talk of the economy, and well, really there's still not a whole lot of direct talk about schools needing to be open for the economy, but it's, like you say, the elephant in the room. It's the truth. And so the adults need to be able to go do things that run the economy, such as work and earn money and spend money. So the thing is, the school systems and really the states all of a sudden have a major bargaining chip, because we have, our president is talking quite a bit about the need to get things open, and he includes schools in that conversation. We have the folks on this in this hearing talking quite a bit about it, and everybody saying, no, we need to do this. We need to get kids back there. We need. And certainly educators everywhere agree with that. But here's the thing, because of how important that process is to the economy, and because of what we're asking all kinds of different people to do, schools, local school districts, and state school systems of education just got a pretty big boost in their perceived value. And so this has major implications for funding of school districts. You know, if there's going to be a federal push to open up schools and get kids back to school, and if legislators are kind of asking for top-down recommendations, they want some sweeping kind of guidelines to go by, so then local school districts can, but they're really asking for federal help. And the federal government's being like, yes, we need to do that. We need to open schools, because guess what? The economy's suffering right now big time. We need to get everything. It starts with schools, like you say, Kevin. So all of a sudden now there's considerations for how much money should be involved in school budgets, how much money should the professionals in the schools be making, how much this, how much that, because if nothing else goes without the schools, guess what's top priority for a healthy economy? So we need to invest in that top priority is one thing I hear. The other thing is, and this goes back to having healthy systems for our kids, and talking a little bit about the professionals that work there. We just need to be very, as maybe Dr. Fauci would say, we need to be very cautious here with the way that we proceed with the people who are running our school systems, because this is a high stress situation for them with a lot of uncertainty. Like, what's teachers all over the country are saying, what's my life going to look like in September? What are the school administrators are saying, what are budgets going to look like next July, as there's 30 million unemployed people, and there's all these schools run on public taxes. You know, even schools that aren't public schools are benefiting from public taxes. And so there's just a lot going on. And then therefore there's a new layer of consideration in terms of teacher stress, which is something that you and I both look into as researchers. And the big thing about teacher stress is the more stressed the teachers are, the less benefit there is for the kids. And also the higher the rate of attrition is. So all of a sudden we're putting this additional stress on individuals and school systems that are there for our kids. So the conversation is vast, and I think school organizations can jump right on this, and if they really want to, they can use it as a bargaining chip for, okay, this is the point in time when we finally get more resources to take care of all the things that we think we need to take care of.
Yeah, thanks for that, Kevin, and thanks for joining me today. I really appreciate talking with you about these issues, and we're really just starting this conversation, and we're hoping throughout the summer to develop further conversations around these topics, especially around how do we support our educators so that they support our students, because they are in the classroom with students on a day-to-day basis, or have been and might be again, and we need to support them in myriad ways, financially, and in terms of their social and emotional well-being of themselves and their physical well-being and curricular resources. I mean, the list is long, and it has to happen now if we're intending to reopen in any capacity in the fall. So thank you so much, Kevin, for joining me today. I hope to have further conversations with you on these topics throughout the summer. So thanks again.
Thank you, and I love the podcast, and I can't wait to listen to this episode and all the ensuing episodes.
Thank you. Thank you for joining us at Educators Respond. As always, we want to send a special thank you to our teachers for all the amazing work you're doing during this difficult time. Also, a thank you to Antis Instrumentals, who provided today's music.